Good afternoon, everyone. My name is Mike Bartlett. I'm a senior policy analyst with the National Governors Association, and you're tuning into today a special webinar we're holding targeted towards state economic development officials, kind of exploring the issue of how are state economic development organizations supporting businesses' personal protective equipment needs during COVID-19, and also just talking broadly about the issues of economic development in these very unique economic times that we find ourselves in. In terms of our roadmap for today, we're going to have, we're very lucky to have some excellent guests with us who I'll introduce here shortly. We'll have some brief presentations by them who will give us kind of an insight on some different perspectives on this question and on this topic. Then we're going to leave some time for discussion and questions and answers for the audience. So certainly as we're going through this entire process, if you have a question, feel free to use the Q&A feature on your message bar there. Further, you can also raise your hand, I believe, using the features here. At any rate, myself and my colleagues will be monitoring the chat and the questions, and we'll try and get the questions to the right place once we come to that point. So please encourage folks not to be shy. And then finally, in the last 10 minutes or so of our presentation, the reason for this call actually came from a project that we're doing in partnership with the Pew Charitable Trusts, focused with a small cohort of states on issues of streamlining state regulatory processes. And this was one of the major questions they had. So we're going to have some updates for them at the end of this call. Certainly, if you're not a member, if you're not Alaska, Colorado, Tennessee, Delaware, or Rhode Island, you can feel free to drop off at that point. But of course, the decision will be totally up to you. So moving right along to our speakers today. Again, we're really lucky to have some thought leaders really joining us who have a lot of expertise that they're going to be sharing with us. Up first, we'll have Mark Tropey, who's a senior research fellow at the Center for Regional Economic Competitiveness. If you're in this field, you know Mark, and he's really well positioned to get a good picture of national economic development trends, and he's going to talk a little bit about that with us. Following him, we'll have Jason Kelly, who's the General Manager for Blockchain Services at IBM. Jason has a long history at IBM, leading several different divisions within the company, doing a lot of very good work on a global scale, particularly at the cutting edge of technology. But he also has a background in state government and worked in the state of Tennessee as that state's lead economic development official. So he knows the life that you all have led and is going to parlay that in, kind of tie some of these threads together. And then last but certainly not least, we're pleased to be joined by Heather Johnson, who's the Commissioner of the Maine Department of Economic and Community Development. Heather has a strong history in economic development, having led a lot of the rural economic development in the state of Maine, but also has a strong private sector and technology background and focus. So she, you know, being a native Mainer, that's rural issues and issues of technology are critically important. So we're really excited to have her experiences as well. So with that kind of, I'm going to just hand it over to Mark. So again, we are going to have some polls, so be prepared to use those. And feel free anytime to start asking questions in the chat. We'll try and make this as conversational as possible. So without further ado, I'll hand it over to you, Mark.
Great. Well, thanks, Mike. And on the next slide, Mike has asked me to touch on 4 different areas to kind of set the stage for the conversation today. So, you know, what roles are we seeing state economic development organizations play in the response to the pandemic and around the PPE? What partners have been engaged? What kinds of data are we seeing as helpful? And what resources have we found as we've done our work in recent months that might be useful to other state folks? And I should say, this is largely going to be drawn from work that we've done with several different networks since March. In part, it's the State Economic Development Executive Network, conversations we've had with Manufacturing Extension Partnership Centers, conversations I've been involved with along the line with the American Manufacturing Communities Collaborative and some other national research and other efforts like that. And then I wanted to bring some data in because, as my old friend John Doerr from Maine has said many times, if you don't bring data, it's just someone's opinion. So I'll bring in some census data that sheds some light on some of the things that are of interest to all of us today. Next slide, please. So not many economic development organizations are known for having real deep pockets. And so we've seen the state EDOs playing many of the same roles that we see during normal times. And that is, you have to be creative, linking and leveraging assets, drawing from different resources. State folks have to be informed about providing guidance, helping to coordinate as a convener, matchmaker, and then for priority areas and when funds are available, providing some funds to support those efforts. And we've seen a progression of activities and these roles evolving as the pandemic has been with us over time in the last several months, starting off with efforts to coordinate with public health and emergency management agencies. And interestingly, EDOs don't have a long track record working together with these other organizations for an extended period of time, like is being required by this pandemic. So we've heard stories about states really wrestling with tough questions like, who has the authority, whose data should we listen to, who has the lead responsibility for action in particular areas, and states that have figured out good working relationships to support that really have come out ahead as a result of that. All the questions around the shutdown, the reopening, and then the rethinking the reopening, the who, the when, the hows, what's an essential business, all of those have depended a lot on input from the business community. And so at the various stages, we've seen associations, we've seen individual companies involved, we've seen chambers of commerce very involved in that discussion. Early on, states put funding into emergency grant programs to both help sustain companies and to support those companies that wanted to pivot to make PPE. And there's a number of states that did this: Maryland, Massachusetts, New York, Michigan come to mind immediately. So that was an effort to get the funding out early on. And then when the CARES Act was passed, we saw states pivoting to work with their constituents to help access the federal resources that were available, the PPP, the EDO, and in this case, they really benefited from where there were good working relationships with associations of bankers and other financial institutions. We saw those states really having a leg up because they were able to help to organize the application process and the response. As reopening has happened, we've seen a lot of collaboration with chambers and business associations to develop guidelines, to put together toolkits around workplace safety. And then most recently, we've seen states, as the federal resources from the CARES Act that went through other federal agencies and existing programs, and I'm thinking like MEP, SBDCs, the Economic Development Administration, the CDBG, these existing programs got funding that either got more flexibility and or funding to help with the response effort, and often had to go through a competitive process. As those funds are now hitting the streets, we're seeing states working to align with those efforts to figure out how to leverage them and make the most of it. On the next slide, please. I just made a list of the potential partners that we've seen. I already mentioned the business associations, chambers of commerce, and intermediary organizations. California provides a really good example where GoBiz, the state agency in the governor's office, partnered with the California Manufacturers and Technology Association, local EDOs, the California MEP Center, SBDCs, chambers and ethnic chambers of commerce to organize information collection, to ramp up production of PPE, to conduct outreach, messaging, and communications. In addition to that, I mentioned the associations of financial institutions. I'd be remiss if I didn't mention collaboration with private sector experts, companies, and universities, especially those that bring expertise with data analytics, logistics, and public health. In Massachusetts, we've learned about the emergency response team effort there. They have a really good example of coming together around PPE. They have, at the current rate, or at the current time, they're producing each week through a collaborative effort about 5 million nasal swabs, 250,000 face masks, and 1 million isolation gowns each week. And that's working through about 50 different manufacturers using $13 million that the state provided to help those manufacturers with the pivot. The companies couldn't take the supply chain risk on their own. They couldn't float the materials purchased for 6 months on their own without the state support. And I heard they said last week that they've sustained about 1,200 jobs because of these pivots. And what we're seeing now is that as the reaction of individual states and organizational efforts to address immediate PPE needs is in place, we're seeing an increased recognition of a need for a broader, more strategic, and often multi-state or regional approaches for both ramping up testing and generating the PPE required to do that. So Massachusetts is part of a 7-state regional collaboration. I've got some notes in the resource slides about Danielle Allen at Harvard and colleagues in MIT and Massachusetts that are really on the front end of that effort, and I'd encourage you to take a closer look at that if you're interested. Next slide, please. So turning for a moment to some data, I don't know how many of you are familiar with the Household Pulse and the Small Business Pulse surveys that Census has done. These surveys are a collaboration of several different federal agencies. They've been doing it weekly from late April through the first week of July. And you can see on the slide that the Business Pulse survey collected information on those 5 dot points, several areas that are of great interest to the folks on the call today. So on the next slide, let's turn to a couple of the data questions that they asked about. And for instance, this first one, did the manufacturer have a direct disruption in its supply chain last week? And you can see from the graph that initially about half the manufacturers responding said that they did have a disruption. That declined to about 1/3 of the companies saying yes as of late June. And that raises concerns and opportunities because changing suppliers is difficult. It's more complicated than simply finding a company that has a capability to produce a component part or a product. You're disrupting long-term business and personal relationships. They have to have a viable business model to justify investments. Demand signals are unclear. And they got to meet high standards around FDA approvals and certifications. Let's take another look at another census question. First, we're going to do one of the polls that Mike mentioned to see how well informed you are on this issue. So, Mike, do I need to wait a second for you to put the poll up? There you go. So what proportion of U.S. manufacturers reported shifting to production of other goods and services as of the end of June? Take a minute and give us your response, please.
And Mark, while we wait on folks to respond to the poll, we did get one quick clarifying question. You mentioned one state had already invested about $13 million for pivoting. Do you recall which state that was?
That was Massachusetts, but the other states that I mentioned also had funds for similar purposes. That's Maryland and Michigan, I think were the other ones that I mentioned.
Great, so all the states start with them. All right, looks like we have some good poll responses here, so I will end the poll. So we can
you put?
It gave me an error when I'm trying to share the results, but what I can do is just read the results out here. So it looks like the winner by a significant margin is the third option, 21 to 30%, with 61% of respondents favoring that one. 23% of respondents favored 11 to 20%. So that was the second most common, and the other responses were quite low.
Well, thanks, Mike. Could you go to the next slide, please? You were correct if you answered 0 to 10%, actually, according to this survey. Initially, about 9% said that they had made a shift. And by the end of June, that number had come down to 6%. So it declined by about a third over the April to late June timeframe. And I think that recognizes the reality that shifting production is really not for the faint of heart, either for the company or for the states that are working to support that. We heard lots of examples from states that were just inundated by companies wanting to do the right thing, stepping in to help. Some did so because they saw business opportunities, and sorting through all of that to find the real value there, the ones that could really deliver product that was needed. It was not as widespread as we might have hoped or as we might have expected. Next slide, please. So we've got one other poll to test your knowledge. What proportion of U.S. manufacturers do you think thought that their business would return to pre-pandemic normal in more than 6 months or never? In other words, it's going to be a while, folks. What do you think?
These are the 21st century skills they're always telling us we need in the economy. It is giving me an error code when I try and launch the poll, unfortunately.
All right, well, Mike, I can step in and help with the suspense if you go to the next slide. You'll see on the next slide that the correct answer was 36 to 55%. Oops. I guess we can just keep going, Mike. We don't need to do the poll since I've given away the correct answer. The yellow-green line at the top of the graph here show the manufacturers who expect it's going to take at least 6 months to return to normal if things ever do. And that number has increased from 38% initially to 52% by the end of June. So folks are beginning to recognize increasingly that we're in this for the long haul here. One more slide before I on the next slide, please. Before I go to the resource pages. So many folks with good reason are worried about business closures and the high risk in coming months of losing businesses permanently. And in particular, baby boomers who are owners of businesses, there's a fear that many are worried that they'll just close their doors rather than trying to figure out how to find their way through the pandemic into recovery. And a number of states that we're talking to are taking some proactive steps to try to mitigate the risk and at the same time to address some of the challenges around PPE production and the supply chain disruptions. And these are states like in North Carolina where they're looking into early warning networks and outreach to at-risk small manufacturers, looking to link economic development organizations with layoff aversion strategies that are required under the Workforce Investment and Opportunities Act, and there's some funding there for that. In Colorado, I've worked with folks who are very closely aligned with the governor, looking at options for succession planning, including employee ownership. So I'd encourage you to take a look at those as some options for dealing with some emerging challenges as we face the next several months. So the last 3 slides that I've got are all resources, and I won't go through them one by one, but I've organized them into sites that list a wide range of state activities, and wanted to give a shout out here to our site for the SEED network, as well as the sites that NGA, NCSL, and CDFA have prepared. These are really excellent resources. The next slide is specifically sites that talk about PPE production that folks have found useful. And then on the very last slide, some of the proactive responses that I mentioned in the presentation, you can get more information on them by following the links on that slide. So Mike, back to you.
Thanks so much, Mark. And there's actually one question I just wanted to ask you, because I'm very bad at restraining myself in these situations. But and this is more of maybe a demographic and trends prediction than anything else. But I'd be curious your thoughts. Certainly during the Great Recession, when it came to baby boomer retirements, we saw many people delay their retirements, both in the labor market and with businesses. Do you expect that same kind of force? People want to stay engaged because of the uncertainty, or do you think that people will finally say, well, now's as good a time as any to just kind of finally retire and make that transition?
Mike, I haven't seen data on that, although we did do a call a week or two ago with Lisa Stewart, who's done a lot of work on succession planning and transitions, and she urged us to not make generalizations. She said she's seeing examples of companies that are actually well positioned to do well during the downturn and during the pandemic, and they're riding the wave and planning to stay in it for the near to longer term. Others who've seen fewer opportunities to be successful are wrestling with some of those choices, and some of it has to do with their own personal financial situation and any preparations that they made before the pandemic hit. So it really behooves us to take a very nuanced and customized look at different types of business and where they fall and how they're impacted by the pandemic, rather than trying to come across with a one size fits all prescription.
I think that's really good advice. Thanks, Mark. All right, moving just right along, I'm going to hand it now over to Jason. Please take it away.
Hey, thanks, Mike. And Mark, great comments. I'm going to borrow some of what you just covered here. I'm going to pull you as you were noting here on some thoughts, and I'll try and, if I can, Mike, even return some time here by just hitting some of the high points when we talk about the private sector and how we respond and work with the economic development organizations at the state or even national, state, and local level. And again, my name's Jason Kelly, and my day job is leading IBM's global blockchain business, which is an exciting task. However, I also have the privilege of leading as IBM's senior state executive for Texas. And I'll start with that thought, because when we think about private sector teaming with the public sector, having been in the public sector in two separate jobs, my first job out of college was in the military, the airborne ranger, and fun time in the Army. My body gave up before my want to did. And then I returned to the private sector and worked in a manufacturing company, helping lead that company until we were acquired by another company, Berkshire Hathaway. Started my own company, also took a leave of absence and served as Economic Development Commissioner in the state of Tennessee for a couple years. Started my own business and then came to IBM. And so through all those different iterations, had different perspective of how I perceived economic development and also its response to business development, business slowdown, business recovery. And in a very, I think, different way of looking at it, that's where we're at now, in a very unprecedented type of challenge. And from that perspective, I look at what IBM does and why I enjoy being an employee here at IBM for a number of years. Is that first, we look at this opportunity in economic development as something that takes a specific structure. So we are structured from the top. We have a corporate and social responsibility group reporting into our headquarters group that takes care of what we call policy versus politics, but policy, and that's the human side of the communities where we live, work, and play as IBM employees. And that's across every continent except one and 120 countries. Here in the United States, we take it down to another level, and we have senior state executives that work, myself included, work as part of their day and night job to make sure that our state is taken care of, in a sense, or we pay attention to what happened in that state for our employees, for our families, as well as those communities in which we work, live, and play. And so that's the start of corporate social responsibility, reporting into headquarters, and then state leaders who are ready to come to the help, aid, and innovation and service within the communities that we live, work, and play. With that structure, now that we start there, and then we say, okay, well, then how do we put that into action? And we'll use the current pandemic as an example, because it could apply to this situation, the annual challenge that we have throughout the South, coastal towns all the way up to the Northeast with hurricane response, or it could be something as tragic as 9/11. When these things happen, we respond in a similar way. We look across the three, we recognize what's happening, we put together the response, and then think about how we can return to some sense of normality or back to where we think we can then be productive. And in the current pandemic, the first thought is, okay, let's recognize what's going on. And this is where I'll kind of revert back to something that Mark said. I loved your statement, Mark, about bringing data. Otherwise, it's just an idea. And so that's in every one of these situations, it's let's get the data, and being the data company that we are, and loving to do that on a platform and cloud, being able to distribute that, we say, okay, great, we can get a lot of data and we can help doing that. So the first thing that we did was respond with compute power, some 400 petaflops of computer power to understand where is this taking place, what is taking place, and how can we start to get our hands around this disease. Also, in putting that compute power, we also bring in some of our assets. And this is, in this case, it was our data that we have from the Weather Company, Weather Channel, to say, look, can we start to understand where this outbreak is happening at what rate and pace? So this thought of responding with content, not a a donation, not just capital, but human capital, compute capital, capability capital, saying what can we take that we have and make it available for our cities, states, and for the nation. And so this is where we say, it's really a sense of a private corporation being part of the public. So we often say private-public partnership, but when you bring it together, it's truly a one-in-one collaboration. And so when we think of local type of needs, and this thought of a pandemic and people trying to understand just what to do, that became our next challenge. We're saying, how do we assist right in that local community? And building off that word assist, we took some AI technology that we have and a capability that we call Watson Assist, which is an AI-based help asset, whether that help is a chat bot or in a call center. Both of those locations are where people will seek information. What if my child is sick? How do I know if they have coronavirus? Where do I go if I think they do? How long should I wait? Common questions. How do we make it so these systems are very smart, so to speak? Well, that's the capability that we made available across the U.S. first, and then took it globally. And in fact, in my home city of Austin was one of the first cities where we made it available, and that's at no charge to just make sure that our communities can quickly get the information that they want, so they can start to get to that next step of responding, of understanding how to respond in this environment. We then also, as part of this, I mentioned structure, we also empower our teams to find new ways to give back. So we can take some of our private sector capability and make it relevant and of even more value in the public sector. And as my title calls out, I do lead a blockchain business. Blockchain is nothing but a different way of working with data and allowing people to share data. And what we were able to do with one of the current blockchain platforms that we have, forget the B word and what it means, just understand that it's a way to share data. And there was nothing better than trying to figure out how to share data across new ecosystems, where you have a General Motors that is making ventilators and trying to source ventilator parts so that they can then take the product and ship it into a new ecosystem that they weren't familiar with before, which is healthcare and medical. How do they match up? How do they find each other? Well, using this trusted matchmaking platform, if you will, we made that available, which is still available to states across the U.S. Until the end of next month. And so by empowering us business owners inside of our company to be inventive, to be innovative, and to give back, we find ways to then make a collaborative effort out of that private-public partnership. We reach out to organizations that can make these things known, not just to create something in a closet and hope someone comes to it. So thanks to organizations such as NGA, we can then have a platform to say, how can we help? They can make that platform available to us to bring those to us that need help, and then also bring us to those that are looking for the same type of assistance. So by reaching out and empowering our teams, we do that. And then finally, this final step of thinking of not just responding, but then also returning to some sense of normal. How do you do that? Well, we see even in the comments that Mark made and some of the links that he left in his on his last slide with regards to this thought of returning equity and to a point of equity after the current pandemic. You know, the pandemic has shown a light on a need for equity and a need for people to have new opportunity. And so this thought of building skills and education is something that we as IBM also have taken very seriously, something we were doing before the current situation, but now it has found a higher purpose as we have a platform for building skills, literally called the Skills Build Platform, as part of a Reignite program that allows us to work with local communities, community colleges, and the like, with free online technical training to help orient people towards new jobs. In the city of Austin, here where I live, many of the service jobs will not exist as we come out the other side of this. And those great workers will be looking for new types of employment, and there's no reason why they shouldn't be able to take some technical training online, get orientated, and then tie into maybe a community college to get that formal education. And as I said that, then the last thing I'll close on is a program that we call Pathways to Early Technology High School, College and High School, PTech, using the acronym. And that PTech program is a 6-year program for students in challenged neighborhoods who perhaps would never go to a 4-year school. And as we know, it doesn't take a 4-year degree to start working these days, especially in the technology field. And so why spend 4 years if you could get it in just your four years in high school and perhaps 2 more? So 6 years of studying to immediately then contribute, along with mentoring and dedication between both a community college, a technical company such as IBM, and the local school system. So that is a true public-private partnership and collaboration, delivering results to get skills into the workforce. And now we've committed to bring 1,000 of those PTech students. We have currently 150,000, I'll say again, 150,000 students in those programs across 200 school systems, or schools, I should say, around the world. Highest concentration here in the US, or here in the state of Texas. So we continue to do things like that in order to aid our communities to return to the workforce and return to that sense of whatever the normal is going to be. So my perspective from the private sector is, just as I said, is we take this thought of structure, empowerment, and then ultimately, as I've mentioned across each one of these programs, focused execution in a private-public partnership. That's what's worked. That's what I've experienced from both sides. And what's best about, I think, trying to get this done is in sharing and communicating, just like we have a platform to do today. So to Mike and the team, thanks for the opportunity to just share a few minutes.
Great. Thanks so much, Jason. A lot of really helpful nuggets in there. And for anyone who's not familiar with PTech, please do look it up. It is a best-in-class model, and the research will bear that recommendation out. But just a few things I heard from you, Jason, that we have to resist the temptation to think it's about getting back to normal, because normal is one of the things that got us here. And what I really heard when you were talking about the private sector angle for states, it's that opportunity to move beyond kind of transactional partnerships and really get into something that leverages the human capital and the resources and brain power that exists in many of the organizations that are already in your state. And it's not just multinational global companies like IBM, but undoubtedly all of your states have a lot of really smart people who have tools and resources and guides that can help really help you take things to the next level. So thanks so much, Jason.
Thank you.
And last but certainly not least, we will turn to Heather Johnson up in Maine. So Heather, take it away.
Great, thank you. So this is two Maine John Dora reference earlier, and now me. So we appreciate that. Thank you. We were going to just spend a few minutes talking about kind of manufacturing flexibility and some of the partnerships that helped our state kind of think through PPE and what we needed and how to move forward. So I would say when all of this started, there was an immediate look around to see what did we need, right? And people, you see the best in people sometimes in these moments. And so everybody rallied pretty quickly to say, we want to help. And you heard Jason talk about IBM, which is a huge company, right? Their willingness to want to jump in, and certainly lots of small businesses in Maine felt the same way. And so there was a real effort around what could we do to be helpful. And one of the great things about Maine, frankly, is, you are 2 phone calls from anyone to get a group together. We don't have a lot of the work that Mark spoke about earlier of kind of who owns what, whose wheelhouse, who gets to make the decision. In Maine, because you have the opportunity, I think, to build these relationships over time, that piece of it is a little bit easier for us. So we were very quickly able to create what we called the innovation team. As you can see, the innovation team was comprised of the University of Maine, faculty, students, and staff, our team, Maine Manufacturing Extension Partners, 3 different healthcare facilities, and those are 3 competitive healthcare facilities. So that was interesting to kind of get them all to the table. And then Maine Manufacturers Association of Maine as well. And really tried to take a look at some steps of what did we need to do, because I would say in the first few days, what you saw was businesses calling all of these people and all of these people doing outreach to businesses to figure out kind of where everybody was. And so it became really clear that organization needed to be put in place so that we could be much more efficient. We certainly don't have a lot of extra resources, so making sure that we were really efficient with our resources was step 1. The university had a lot of flexibility with students and graduate students who were willing to kind of jump in and help with some of the project management work as well. So, it gave us a chance to bring in students to decision making and some of these kind of crisis management moments that they might not have had experience developing before. So there were a lot of good opportunities there, but it became really clear that we were having a shortage of the PPE materials and sanitation materials that hospitals needed, healthcare centers would need, and as we looked forward, what we would all need to rebuild our economy and our education systems. And so that was kind of where the team started. When you get into those healthcare arenas, though, there was a lot of concern about how products would be distributed, where the liability sat, a number of those other pieces, how testing would happen. And so our emergency management agency also jumped in, and they became the distribution arm for all of the goods and services. And that helped have one coordinated effort. So the state's effort was primary, and then this innovation team's effort really could be supplemental to that and run in parallel as needed. So that was a big piece of the equation, making sure that MEMA was involved because of the structured coordination infrastructure that they had that they had the opportunity to use. So when we started doing that work, it became really clear that we didn't know what people needed. Do you need masks? Do you need hand sanitizer? Do you need gowns? Did you need booties? Early on, right, it was very clear that you were going to need almost everything. So then we kind of cataloged those needs, took a look at what was available nationally and what wasn't available globally even. And then what did our manufacturers have the opportunity to create? And really started there with what could we do? What were the easiest things to do so that we could turn them pretty quickly? And then how did we set out a long-term schedule to support manufacturers as they moved through the work? And so Maine MEP took that kind of cataloged list and then got specs for those products. So manufacturers didn't have to guess, will this work or won't this work? If I build it to this spec, will it meet the standard or not? We created a database of those standards for companies to be able to look at. There were prototypes, there were even processes that the teams were able to put together and work directly with manufacturers on the potentially the how that could happen. Early on too, it became, we have, just to have a step back, we also have a materials testing lab and the composites material lab, which allowed us to test respiratory values, the value of the material being used, did it meet, the quality standards that we would need it to meet. So those were all things I think that were really critical as we started to go forward. If you want to go to the next page, Mike, that would be great. So as we did that, so catalog the needs, we talked about that, the information, the product evaluation piece was really important because different hospitals had different ideas about what they wanted. US CDC had a different set of standards, and Maine CDC sometimes had a different set of standards. And so a lot of times there was no, yes, this is the right design, this is the right material. It was, this hospital needs this type of support, this other hospital needs this type of support. And then we knew there were rural hospitals that maybe weren't a part of that work that would need things as well. So this evaluating the prototype work was an important piece because the manufacturers had to have enough volume to be able to make it worth their while. Mark talked earlier about how hard that shift is and why more manufacturers didn't make that shift. Part of it is volume and how much volume could you generate out of any of these prototypes. And so then became the interesting negotiation of really what were the priorities for hospitals, where could they get to alignment and agreement and those types of pieces. And so they did a really good job working through that, sharing information, sharing resources, and that was incredibly helpful there. So it became pretty clear that there were a couple of areas that our manufacturers had opportunity, and one of them was face shields. So we had a number of companies. One of them used to make backpacks. Some of them made plastic that went in very different kind of structural work, but they were able to very quickly change what they did, what they used their equipment for, and get enough supply in on the front end to start putting out. You can see a picture of the flow fold mask in the bottom left of that slide. And those are able to be used in hospital settings and in non-hospital settings. So what that allowed us to do is prioritize those shipments into our hospitals. It created a base for Flowfold to be able to make them. They are making now about 50,000 of those a week. And so that's a pretty big step and a great opportunity for the hospitals to get the materials they needed and for a Maine company to be able to create some different production. The other thing that the university actually took the lead on and did a really good job with was hand sanitizer. Hand sanitizer was a struggle for our state and probably many others at the beginning. And it's interesting because this is a fairly creative thought. We have a really large craft brew industry in Maine, and they were able to rework what they did in partnership with distilleries to coordinate an ethanol supply, which was really hard to get there for a period of time. That allowed the university to make 50-gallon drums of hand sanitizer. So then again, that didn't necessarily go to the hospitals because hospitals could source hand sanitizer, nursing homes, child care facilities, those types of places, congregate care facilities that had a much harder time were able then to get really low cost, high available hand sanitizer that met the standard, and it could be delivered to them quickly and easily. So it was really looking at what are the needs? Where can we align those needs? And what are our abilities? And putting those pieces together, and then dispatching resources to try to support that work. Now it takes a little bit less work from us because the companies that were going to make this adjustment have done it and are doing it successfully. Now it continues to be as schools start to come back into session, and as private high schools and private colleges come back into session, how do they get access to some of this material to make sure that we're supporting these Maine businesses along this path. So it's been, a really, I think, great example of how collaboration can work if everybody has the same goals. And this was one of those cases where it's pretty easy for people to see what the goal was and align to it. So.
Great. Thanks so much, Heather. I'm a Kentucky native if my accent hasn't given it away. And I never was I never had reason to be down on the bourbon industry, of course, and they've really come through in this situation. So it's a continued blessing for Kentucky, at least, and glad to see the craft beer industry in Maine being able to help out. One of the things, Heather, I really heard, or it was kind of three words, coordination, organization, and trust. And I really kind of want to dig, just kind of ask you quickly, when it came to trying to organize some of this effort and be that trusted relationship broker, did you just have a whiteboard full of yarn and, sticky notes, or what was the process your team used to try and wrap their arms around this?
We had some really good leadership in the university and Maine MEP that, really brought a lot of resources to the table in partnership. And so what we did early on was did just kind of daily sessions of, okay, who are you talking to, who you're talking to? We shared back end, even files so that we could see who was doing what to make sure that, the limited resources we had were allocated in the right places. I think it wasn't as much about ownership as it was about alignment and the team. I think in these kind of really hard crisis moments, people come forward, and that team, I think, did a great job.
Well, it sounds like you all had some good relationships as a foundation. My experience from working in state government has always been that, partnerships move at the speed of trust. So when you have that, it allows you to do this kind of work. So that's great.
Absolutely. I would say we didn't have the relationships, particularly at the hospitals. And so that was new for us. I think they had relationships in state government as hospitals would, but not with kind of economic development or innovation. And so that was something that was an interesting piece and kind of developed along the way.
Great. So what we'll do now is transition to a brief, Q&A. So I already see one question that's come in, but feel free to use the chat feature, use the Q&A feature, or raise your hand and I can unmute you. The first question we have here, though, looks like it's for you, Heather. So for specifications and volume coordination, did that flow through Maine ECD, or did it flow through Maine emergency response?
The spec work really was primarily at Maine MEP. They were the lead on that work because they did the real process development pieces. We took their work and then went back to the CDC or hospitals and said, does this pass your standard? Will this meet your standard? And so it was a back and forth, I would say. We did the kind of higher level, what type of products are you using now? So that then we could look and try to mirror to those. But Maine MEP and the university did kind of the testing and the other work. And the volume coordination, I would say we did a lot of the front end planning work. And then MEMA, the Maine Emergency Response Group, did the actual execution shipping work.
Great. So while we wait for some other questions to roll in here, one I wanted to pose to the full group was, we're kind of beyond the initial crisis response phase, and it looks like we're settling down into kind of a long haul of of different types of economic response. Certainly, it seems we officially entered a recession today. I would just be curious from kind of each of your perspectives, and maybe Heather, we'll start with you and work our way backwards. You know, what do you think would be, you know, if you were talking to your peers or to just, you know, governors and state folks in general, what are the, you know, top 1 or 2 things that we should be, you know, kind of have our eye on? What's the ball we need to have our eye on here in the midterm?
You know, I think in the midterm, there are a couple of things. One is, how do you create capacity for business? How do you create stability and reliability? Because I think some of the charts we saw in Mark's session indicated, right, this could be a long haul and we don't know how long. And so that uncertainty is always difficult, I think, for businesses and organizations to navigate. So anything that we can do to create capacity and stability are the things that we are trying to do. The other piece is, I think, as planful as we can be. We want to be that, so that, you know, we're all able to organize around their own work. So, and that transparency is critical. So those are a lot of things, maybe not one, but those are a handful of things that I think are really important. And you know, some kind of business sustainability programming is gonna have to be key.
Thanks. Jason, I'll turn to you. We've also gotten a question. Are there other applications for the trusted supplier blockchain solution besides just matching PPE supply and need? So what are some other applications of the tools you have?
Oh, absolutely. This thought of matching in a time of crisis is easy to kind of call out. Just an example that we had here with regards to a brewery that's making hand sanitizer, you know, trying to match those ecosystems. But then even as you think of what we now see in transparency of any given supply chain. So this is beyond just a challenge of a pandemic. It becomes, how do I now source beyond my normal large suppliers, if you will, and how do we open up markets for those that may pool their batches in a collaborative or co-op type of effort. So there are opportunities to do that because of the trust. And I love the phrase that, you know, it's the partnerships work off of trust. And if we can add trust, which is what the technology does, to those ecosystems, it then opens up for new players and new markets. So I think that thought in answering your blockchain question, I'm also then addressing this other thought, you know, as we see a challenge in the economy, it is looking at different business models, different ways to bring new market entrants, as well as focus on our communities in the education.
Great. And Mark, there's one question here I'm going to ask you to speak to, but Heather may want to weigh in on this one. And then I want to make sure we get to our other agenda item as well. And it's kind of this question of, you know, what's the balance or what's the nature of the relationship between state and local government? So, you know, what's the, you know, what are the roles and responsibility of the state versus, you know, and then how does that work filter down at the county and local level? So, you know, Mark, I'd love to hear kind of what you've observed nationally, and then Heather, the specifics in Maine.
So Mike, my sense is, you know, especially if we're in this for the long haul, it's going to require all hands on deck. And the state obviously is in a leadership role with the bully pulpit and the governor's office and resources and programs in place within the state. And you know, to echo Heather's earlier point about the importance of business sustainability programs, you know, don't underestimate your ability to use what you're good at, linking, leveraging, collaborating, matchmaking, all the things that economic development folks do on a regular basis. But you won't be as successful unless you're engaging all hands on deck. And by that, I mean, you know, the networks that are out there, the different parts of the ecosystem at the local level, at the regional level. That's the only way that you're going to really reach the corners of the state and all the different interests that are out there that could benefit from that kind of support.
Great. Final thoughts from you, Heather.
Yeah, no, I absolutely agree. I mean, we will need more people and more resources than we'll ever get. So I think if we can work with communities in a way that works for them, right? And really what we've seen are you shake out into 3 or 4, right, places where the community really wants to take the lead, the community wants the state to take the lead, and any and all of those can work. I think if we're just clear with what their interest is, we can be malleable enough to make either of those work and kind of group communities together. So that's what we try to do is understand where those resources sit, how to best support, amplify, accelerate those resources, and then work in those smaller groups so that people are getting what they need.
Great. Well, this has been a really great conversation. I wish we had, another hour or two to really dig in on this, because there are just some really nice insights, a lot about coordination, trust, organization, partnership, a lot of good learned experiences here. Unfortunately, we don't have, time is a luxury that we all don't have all the time. So I would like, everyone in the audience to please join me in thanking our speakers for their time today. Really appreciate their willingness to share with us. Final housekeeping things before we go on to the last agenda item. We will be sharing the recording of today's webinar as well as the resources. So you saw a great list of resources that Mark shared. We're going to be compiling those and some others we've stumbled upon to everyone who's on today's call. So please look out for that. And certainly if you have a good resource in your state, something you want to share with other states, feel free to send those to us at any point in time, and we'll do our best to disseminate those broadly. So at this stage, with the last couple minutes we have left, we're going to transition to talk to the states of the NGA Pew Policy Academy. So again, Alaska, Tennessee, Colorado, Delaware, and Rhode Island. So if you're not one of those states, you can feel free to go about your Thursday. And I will now hand it over to Mark Robin from the Pew Charitable Trust to just share a couple very quick thoughts and updates with the group. Thank you.
Yeah, thanks, Mike. So as Mike said, I'm Mark Robin from Pew. For those of you who are on the teams for the joint Pew NGA Policy Academy on regulatory process streamlining, we just wanted to have a quick chat, a quick communication with you all, since it's been a while since coronavirus has kind of taken over everyone's agenda. So we just wanted to kind of reach out and talk briefly about some updates on the Policy Academy and kind of how we're thinking about the next steps. All the team leads are going to be hearing from us pretty soon, if they haven't already, to kind of catch up and see where things stand with you guys and what you're dealing with. Obviously, we expect things have changed. Things have changed for everyone, for Pew and NGA, and most importantly for you all in our cohort states. The situation is obviously changing rapidly, and that said, I think we continue to see regulations as being an important part, potentially in the recovery of business activity and state economies. Right now, states are thinking about new regulations and have already implemented new regulations on, how businesses can even operate in a COVID environment. Once we get a more consistent reopening of businesses, I imagine you all will be thinking about how businesses go about reopening, how you're retaining businesses, new businesses, and entrepreneurship, and regulation really affects all those things. So we do plan to continue the Policy Academy in some form. We're going to be maintaining the focus on regulation and process streamlining as much as we can, but we understand, and we want to be responsive to how your priorities have shifted. So again, we'll be reaching out to the team leads to kind of talk about how your priorities have shifted. We know we've heard even some agencies dealing with budget, shifts in their budget and things like that. So whether the Policy Academy includes a modified version of the original plans or an entirely different plan, or really even a structure that looks very different, we're open to a lot of different things. But we do think it's something that will be hopefully on on the minds of policymakers and officials who are, overseeing businesses as they try to respond and recover from this. So we're at 4 o'clock here. I don't want to take too much more time, but just know that we're thinking about this and we'll be reaching out to the team leads pretty soon.